Good evening, everyone. Thanks for joining this Facebook live session on management of prostatic cancer. I am Dr. Mohankumar. I am a consultant urologist, laparoscopic surgeon, and robotic surgeon from Apollo Hospitals, OMR, Chennai. This evening, I will be talking about some basic concepts about prostatic cancer, how we diagnose it, and what is the management options we have. So prostate cancer is cancer which affects only the males. Usually it affects males more above the sixth or seventh decade. Prostate cancer usually is a very slow growing cancer. So I want to keep it more like a didactic lecture, this thing than a question and answer session rather than a lecture kind of series. So first I would tell something about the incidence of prostate cancer and how we are going to diagnose it. The incidence of prostate cancer is one of the commonest cancers in men, and it is the commonest cancer in men above 60 years. Even though it is indolent cancer, there are a lot of people who have prostate cancer because prostate cancer is a thing of aging. It's a byproduct of aging. As men age, the prostate undergoes some transformation and it undergoes cancerous changes. So people more than 70 years, 80 years and all have lot of chances of having prostate cancer. So what are the symptoms of prostate cancer? The symptoms of usually in the West and all, the prostate cancer is detected asymptomatically. The screening is very good in the West, so the prostate cancer is usually detected in the early stages itself. But in India, usually the screening is not that great. So we used to get the cancers at an advanced stage. But of late, the screening even in India, it is really good. So what we get is, like, because of the awareness of people and the health screenings and mass health checkups, we are now routinely picking up the cancers which are very early. So what are the symptoms? Usually, as I told you, there are not much of symptoms, but the symptoms what the patients can have is, like, lower urinary tract symptoms, like of the simple prostatic enlargement. The patient can have a decrease in flow of urine, and the patient can have bleeding in urine. And the patient can have other low urinary tract symptoms. These are the symptoms due to the enlargement of the prostate. When the cancer, it is not specific for cancer. When the cancer spreads to the other part of the body, like the bone and all those bone and all, then the patient can have pain. So all those symptoms can also be there. So how do we diagnose prostate cancer? The prostate cancer can be diagnosed by multiple means. The first and foremost is the prostatic specific antigen, or the PSA, prostate specific antigen. This is a very good marker for prostate cancer. With this combined with the digital rectal examination, when we examine the prostate by the rectal examination, when they have cancer, it will be a bit harder to examine. So the rectal examination as well as the PSA put together gives a good accurate gauge to see whether the patient has got a prostate cancer or not. So usually the PSA is less than 4. If the PSA is greater than 4, we have a bit of suspicion, and if it is more than as the PSA increases, the suspicion also increases. This is just a simple measurement. The the way to diagnose is by a biopsy. So what we do is, like, we through the anal canal, through the rectum, it's a transrectal biopsy. Through the anal canal, we put a small probe, which is an ultrasonic probe, and we visualize the prostate, and we take some small bits of the prostate for the histopathology. That will give a measurement. So this is about the biopsy. So people can ask, like, who are all prone to get prostate cancer? see the prostate, any male can get prostate cancer. So as the age increases, the incidence and the chances of having the prostate cancer increases. And most importantly, if you have any family history, if for example, if your father or a grandfather who has history of prostate cancer, then your chances of having a prostate cancer increases. So usually the screening starts after 50 years, but when you have after 50-60 years, but when you have a family member who has got history of prostate cancer, then your screening can be started earlier. Which is the way to do a screening? The simplest screening tool is a PSA and a digital rectal examination. So once the PSA becomes high, then what do we do? So if the PSA is very high, then we can just take a biopsy and do the make the diagnosis. And when the PSA is borderline, then we can do a digital rectal examination, and the digital rectal examination along with the PSA can give you an approximate estimation of whether the patient has got a prostate cancer or not. Nowadays we have good imaging tools to see whether the patient has got prostatic cancer to accurately assess. For example, if you have you can even use a PSMA PET CT scan or a multiparametric MRI to assess whether the patient has got prostatic cancer or not. We can be mostly a bit sure of finding out whether the patient has got prostatic cancer or not before doing the biopsy. Biopsy is the most important thing. Then the next step, once you diagnose the prostatic cancer, next step is to see the treatment. Before the management depends, the management is dependent on the stage of the disease. So after diagnosing whether if the patient has got prostatic cancer, the next part is going to be to stage the disease. Stage the disease in the sense, like, you have to find out whether the cancer is only in the prostate, or has it spread a bit outside the prostate, or has it spread to the other parts of the body. Prostate cancer is one very good, I'm not saying that it's a good cancer, but it is one of the better cancers to have, because the prostate cancer is one cancer in which you have treatment for every stage of the prostate cancer, be it stage 1, stage 2, stage 3 or stage 4. In every stage has got treatment options. And if and the prostate cancer is an extremely slow growing cancer. So once you diagnose, you will have time to treat the patient. So now I'll tell you what are the treatment options for each and every stage of the patient. So what happens is, if it is the first stage, in the first stage, the ideal treatment is going to be either surgery or radiotherapy in the first and second stage, in the sense, if the prostate is only the cancer is within the prostate. In the third stage, if the cancer has gone a bit outside the prostate and to the lymph nodes, then you can have surgery as a part of a multimodality therapy, which can include radiotherapy also, or you can even offer radiotherapy to the patient. If it is stage 4, if the cancer has spread outside the prostate to the bone, then the most important then the thing is, like, the option is going to be a purely controlling. It's going to be a cancer controlling surgery, not a curable cancer controlling therapy, not a curative therapy. So these are the options available. The options in surgery, when I say in first and second stage you can do surgery, there are a lot of options of surgery. Initially when we used to do surgery, we used to do only open prostatectomies. When we do open prostatectomies, what happens is, the suturing might be problematic, and you can have lot of issues. There can be leak, there can be lot of blood loss, and if you have a scar, big this thing, you can even have the post-operative recovery might be delayed, and the incidence of incontinence, and as well as the erectile dysfunction and all are more in patients undergo open prostatectomies. The surgery itself is going to be very difficult and cumbersome for the surgeon as well as the patient. Now with the and after that, after the open era, we had laparoscopic prostatectomies. But even laparoscopy is a bit difficult, because suturing in the pelvis, in the narrow pelvis, is a very it has got a very long learning curve. But now with the advent of robotics, the most important advantage of robotic in urology, I would say, is in prostatic surgery. Why? Because in the pelvis, the dissection in the pelvis is a breeze when you do with a robotic in the robotic platform. Why? Because the robotic platform has the advantage of increased the vision, magnification, and it mimics the human hands, and in certain places it is even better than the human suturing, because in the narrow pelvis, with the vision and with the with the proper vision, you can suture really good, and with the magnification and the precision of the robot, what we can do is, like, we can achieve nerve sparing in almost all the cases when it is indicated. So when you spare the nerves and when you have a proper urethral margin, so what happens is the incontinence rate also is very less, and the erectile dysfunction is also less in a robotic platform. So as in especially in prostate, the robotic platform is a blessing, I would say. We even discharge the patients on the first day or the second day. So the patients also go home with a catheter, and they come back for removing the catheter. The patients can start their work or the day-to-day activities on the next day itself. That's the advantage of the robotic platform, which is a very minimally invasive approach. Now, who will, the questions are, who will get prostatic cancer? As I already told you, there are a lot of the people, any male over the age of 60 or 70 can get cancer, and as the age progresses, the incidence increases. And if you have a familial history or any history of any prostate cancer in family, then your risk also increases. If what are the other treatment options we have already discussed, and is there any medicine for prevention of prostatic cancer? No, unfortunately there is no medicine you can take to prevent prostatic cancer, but if there are stage 4, we have medicines or injections which can keep the prostatic cancer under control. So this is in short a bit about the prostatic cancer. As I already told, the good thing about prostatic cancer is that there is treatment available in each and every stage of cancer. Now when you come to stage 2 or stage 3, you can even have radiotherapy for prostate cancer. Radiotherapy, initially when we used to give radiotherapy, the patients we used to have, because the prostate is near the bladder and the rectum, the patient will have a lot of bladder symptoms as well as the rectal symptoms, have bleeding and all those stuff. But now with the image guided radiotherapy, with millimeter precision, we can target only the prostate, and we can make sure that the entire radiation is concentrated only on the prostate with no scatter effect. So the advantage of the with the recent technological advancement in the field of radiotherapy, even radiotherapy is is safe in patients, and it can be given with minimal side effects. When it comes to stage 4, if you have when the cancer has spread outside the body, when outside the prostate into the other parts of the body, so unfortunately we'll not be able to give the patient a complete cure. But fortunately, in prostate cancer, what happens is, even if it is not cure, we have methods to keep the prostate under control. So the commonest question people ask is like, doctor, my dad or my uncle had a prostate cancer, but the doctor didn't prescribe treatment for the prostate cancer. He told us to remove his testicles. So how can removal of testis cure prostate cancer? See, the thing is, you have to understand that prostate cancer is a testosterone dependent cancer. If prostate is a if you can equate prostate to a vehicle, the testosterone is the fuel to the vehicle. So if you cannot cure the prostate cancer, the other option is going to be to control it. To control, what you can do is like you can control the testosterone, you can eliminate the testosterone supply. So then the prostate cancer will automatically be under control to a certain extent. But what happens is sometimes some people will not want to want their testes to be taken out. Then what we can do is like you can do a chemical, someone call as chemical hormonal manipulation. We can do a hormonal manipulation. Even you can give injections to keep the testosterone level under control. So there are a lot of steps. You can have testosterone. We can do orchidectomy. We can give LHRH agonists and antagonists. And when even if after these therapies we can, if the cancer is not under control, we have all the other drugs like abiraterone, enzalutamide, and chemotherapy drugs like docetaxel and all those stuff. These are all medicines which try to keep the prostate cancer, which is already spread outside the prostate to the body, under control. So, but even after the patient is metastasis, the prostate cancer is a bit slow growing, so you will have some time to act. And even in stage 4, there are therapies which can help the patient live we can give the proper quality of life to the patient. Once these are the medical management. Once the cancer has spread to the bone and the patients have severe pain, then we can when what we have is like the palliative therapy, the targeted radiation to the bone, the place where the cancer is there in the bone, where the pain is. And when it involves the spine, and if the spine is a fracture or something like that, when it becomes unstable, then we can do surgeries to stabilize the fracture and all those stuff. So these are the treatment options available for cancer prostate. So the next question. So I think I've almost clarified most of the doubts regarding prostate cancer. If there is any doubts anyone has, I'll be more than willing to answer the questions. So hope you understood the basis of prostate cancer and the treatment options available. And we have the state of the art treatment facilities at Apollo Hospitals, Chennai. So be it surgery, be it radiotherapy, or the hormonal therapy, everything can be provided under one roof in a hospital. Thanks for your patient listening and the interaction. Have a good evening. Thank you. Thanks a lot.